for joining us today. I would like to let you introduce yourself a little bit about your journey and your role.
Thank you so much. I'm truly humbled and honored to be invited to speak with all of you today. So my name is Roger Wong. I am a clinical professor in geriatric medicine and faculty of medicine at the University of British Columbia. I'm also the Vice Dean Education for the faculty. So my portfolio is to provide leadership and support to all of the educational programs and services that are offered through the provincial faculty of medicine. I'm really delighted to be speaking with all of you. I know that we have many students and learners in the audience, and that's fantastic. A lot of the work that I do in geriatric medicine, I look after older adults, including those who might be living with vulnerable conditions, such as dementia, such as Alzheimer's dementia, and others. And others oftentimes involve their loved ones, their families, their friends, their neighbors, what we call the care partners. So really excited to be with you today.
Thank you. Just following up on that and sort of the growing challenges of dementia, especially in BC today. We've linked a recent article that you spoke on, and you highlight the stark realities of dementia in BC, including how it affects Indigenous and ethnic communities disproportionately. Can you shed some light on this and provide the audience with a little bit more information?
Absolutely. So one of the roles that I serve actually nationally for Canada is that I am the chair of the Research and Knowledge Transfer and Exchange Committee at the Alzheimer's Society of Canada. So there is a huge amount of ongoing research with new data that is coming up about dementia and Alzheimer care in Canada and also around the world. What you refer to is a recent publication by the Alzheimer's Society of Canada. It's called the Landmark Study Part 2. What we know is that in Canada, just like many other parts of the world, the number of individuals living with dementia is on the rise. And that also applies to British Columbia, just like other parts of the country. In BC right now, as we speak, there are approximately 84,000 British Columbians who are living with dementia, and that includes the most common type, Alzheimer's dementia. If nothing were to change in the next 30 years, by 2050, that number is almost going to triple, and that's a significant number. We also learned from the Landmark Study Part 2 that some Canadians, in particular those who are coming from underrepresented backgrounds, can be affected disproportionately. So, for instance, we know that Canadians of Asian ancestry, again, their projected increase in the number of Asian Canadians who are living with dementia is going to go up by 8 to 9-fold of the current number nationally. And that includes in British Columbia as well. And that's huge. That's significantly disproportionately higher than the general population in Canada. We also know that British Columbians and Canadians who are, for example, of Indigenous ancestry, who are of Black ancestry, who are of Latin American ancestry, are all going to be disproportionately more affected than the general Canadian population.
These numbers are huge, especially our organization and our viewers work with the Alzheimer's Society, and just knowing the impact and the work that we do and how the audience that's there, that's huge.
Yes, and if I may, one of the things is actually really important because every January in Canada is Alzheimer Awareness Month, and just like any year in 2025, there's a theme, and I'll quickly share with the audience the theme for 2025. Which is to say that for individuals living with dementia, while there's no single roadmap, all of us in a community are really enthusiastically supportive to be your guides. And that's really important because all of us, there are a lot of things that we can do to try to support persons living with dementia, their care partners, but also for ourselves as in a community, there are things we can do to prevent dementia.
Absolutely. Sort of moving into that, a little bit about your work with acute care for elders units. It has been groundbreaking for outcomes for patients with dementia and Alzheimer's. Could you share how this model makes a difference in and how it might be adapted and scaled to address dementia care, and also in these underserved and diverse communities?
Well, what I can say is the acute care for elders model, or we abbreviate it as the ACE or ACE unit model,
Mhm.
has been around in Canada for at least 25 years. In fact, I remember this is the 25th anniversary. 2025 is the 25th anniversary of
Mhm.
the beginning of the ACE unit, initially in Vancouver at the Vancouver General Hospital. It's a specialized hospital unit to serve the needs of older adults and their loved ones. And it has five principles. Very briefly, they are the principles of person-centered care, principle of prepared or older person friendly environment, a principle of early rehabilitation, a focus on function, principle of frequent medical and functional review, and also enhanced discharge planning. So when older adults require hospital admission for whatever reasons, typically with medical conditions that require that treatment and diagnosis, a lot of times when they come in a hospital, their functional status can be adversely affected. So these principles, which is very holistic and involve multiple health professions, interprofessional approaches, are there to making sure that we maintain and promote the functionality of older adults. And that clearly is true for individuals living with dementia as well as their care partners. We know, for example, persons living with dementia are more at risk or more likely to develop delirium or acute confusion state when they are, going through an acute medical condition. So I think there's some of the key things that we really have learned for not just for dementia, but for older adults is really that holistic approach. And I think for all of us as medical and health professionals, when we talk about healing, the word heal actually has its root on the meaning of making whole again, not just medically, but really holistically. You talk about physical health, we talk about mental health, but also well-being overall. I really think when I look into the next 25 years for the ACE Units program, the focus has to switch not just from a disease model, but to a well-being model as well.
Absolutely. That perfectly segues into my next question, which is healing. And you'll also talk a lot about connection in a lot of previous interviews. And you speak how like a simple power of a high five can symbolize human connection and it's beyond words. Could you share about how moments like these, for any future doctors or future healthcare professionals listening, how they can shape sort of care and have these emotional rewards in care?
Well, one of the things I really have learned over the years is the power of compassion.
Mhm.
Compassion towards the people whom we are serving, whether they are our patients, our community members, their loved ones, care partners, but also compassion to ourselves, because self-care is really important. The story that you're referring to actually is a story that I have obtained a very generous permission from the patient to share nationally and
Mhm.
internationally. It was with an older adult who is living with a long-standing health condition that somehow limited their ability to speak in verbal language.
Mhm.
During the clinical assessment, the person was really happy and the person started to high five with me. So I thought, okay, this is cool. So started high fiving, except the person wouldn't stop. So we keep on doing this. And it was amazing. And the family member who was present said, Dr. Wong, could we take a photograph of you? And I say, sure, you can do that. And I think my learning there really is a very humbling experience, is that I've learned that compassion is not necessarily conveyed through spoken language
Mhm.
verbally. I
Absolutely.
think, it's coming from the heart. And for this particular older adult, the person who is high-fiving, it is their way to expressing their gratitude and their appreciation. And I think we all learn from that.
Absolutely. Sort of going into, so a lot of our audience are undergrads and younger generations. And one of your other TED Talks where you talk about sort of fostering empathy and compassion across generations and encourage younger people to see aging as like an enriching phase of life. What message do you hope this will resonate when it comes to supporting adults and like combating age-related stereotypes?
I think that is so important. And I'm so grateful that we're able to talk about our life journey. Every one of us is aging as we speak by the
Yeah,
second and by
exactly.
the minute.
Hmm.
And so our experiences throughout the whole life journey can be really instrumental in not just shaping our own lives, but for those who are living around us, our loved ones, our family members, our
Hmm.
neighbors, our friends.
Hmm.
Intergenerational engagement is a concept that we talk a lot about.
Hmm.
And in fact, for older adults, the benefit could be really mutual, not just for the older persons, but also for the younger persons.
Hmm.
And we have heard many anecdotal stories, whether it is students living in houses where older adults live, maybe as tenants, or it could be involvement in community supportive services or group activities, and it can be very enriching. I think the one piece that I will remind all of us is, we're right in 2025,
Hmm.
and it is right in the middle of the decade. As
Hmm.
it turns out, the World Health Organization has actually declared the current decade to be the decade of healthy aging.
Hmm.
And so we know that ageism is very much real and is alive.
Hmm.
So every one of us are really inspired to do something to combat and remove ageism. And I think by taking part actively in intergenerational activities, we can go a long way in doing that.
Hmm. Absolutely. Yeah. So just to end the interview for some advice for sort of ex aspiring healthcare leaders, as someone who has so many different roles and has a long career in sort of mentorship as well, what is one piece of advice you were offered to a undergrad student or young professional aspiring to make a meaningful impact in medicine and geriatric care?
Well, this is very close and dear to my heart because I would agree that I have held many roles, and people would describe them as leadership roles, whether it is in the clinical world, in the academic world, or serving the community. I really think these are service roles. So my role as a leader, whether it is within the province, within the country, and in the world,
Mhm.
I feel my job is to grow more leaders, to really try to lift others up. And I
Yes.
think for our up and coming leaders, which is all of you who are viewing this interview, my word of advice, if there's such a thing as a pearl of wisdom, is to believe in yourself. Know that you can make a difference. The journey could be different for every one of us, but I think, having that commitment, that dedication and compassion is really important. I was actually working with a patient in the hospital the other day, and their loved ones, their care partners, their families. And they made a comment that really touched my heart. They made a comment and they said, "You know what, Dr. Wong, thank you for everything that you're doing for our family member. And we are so grateful to see you bring that humanity to a very busy world." And to me, I think that's important, is all of us, regardless of our age and the stage of the life journey that we're in,
Mhm.
we are there to bring that sense of humanity back to the world.
Yeah. Absolutely. I think that's great advice, especially for students sort of like there's a long career and there's a lot of things you sort of can forget about adding that piece of humanity and remembering even in a fast-paced environment to sort of remembering that care has starts with humanity.
Absolutely. And I think the humanity, as I mentioned, as an exemplar, the compassion It's
Mhm.
important to be compassionate to all the people whom we serve, but also to ourselves.
Thank you. Thank you so much for interviewing with us and providing a lot of insight into dementia, geriatric care, and sort of inspiring the next generation of leaders. Thank you.
Well, thank you so much for having me.